Okay, as I just mentioned, I want to be able to show you how to use the Kinesio Tape to help support the wrist and to decrease the symptoms of carpal tunnel or of pronator teres syndrome. So what Kinesio Tape is it is a stretchy, elastic tape that helps remind the body to keep joints in the proper position. It also helps to lift up the skin, to pull out to allow the lymph to pull out any inflammation that's in the area. So then less inflammation equals less pain. But I personally use rock tape. I find that it sticks longer and better, and it does come in fun designs. You can get just plain colors. This is the biohazard. You can do black with skulls. There's solid pinks, blues, greens, yellows. You know, we've got pink camo, green camo. There's a whole bunch of different things you can do with the tape, and it can be decorative at the same time. A lot of times you might have seen Olympic athletes or CrossFit athletes or people running marathons using this tape. It also helps decrease muscle fatigue in those athletes. So there's a lot of benefits to it. But anyways, what I've done is I've taken the biohazard tape, or the Kinesio tape, and I've cut it to the length that I wanted it, and I've rounded off the edges. If you leave it with the squared edges, then sometimes that frays and gets caught on things. So it's just a little bit better to round off the edges. So I've got a longer strip, then I've got a little bit shorter strip, and you'll see what that's used for in a minute. So what we're going to do with the Kinesio tape is, again, we want to remind the body the proper position for the joint. The proper position for the wrist is not straight like this. Neutral position for the wrist is actually pulled back just a little bit. So we want to remind the body that that's the best place for the wrist to be. Now, sometimes this tape is easier to apply if you have someone else help you with it, especially on the wrists. But for these purposes, I'll just show how to do it on myself. So again, we want our wrist back in that position. So I'm going to get the end to stick there, and the adhesive is activated by rubbing on it. I'm going to tip my wrist back as far as I can, and I'm going to attach it back here on the forearm. So you can see that there's this space in between there. So then what I'm going to do to take up that space is I'm going to flex my wrist all the way forward into it to get it to stick to the skin. And I'm going to, again, warm it up to activate the adhesive. So then when I'm just sitting here and I don't think about it, the tape automatically pulls back my wrist into neutral position. Now the next part that I'm going to do is we want the actual carpal tunnel, we want it to open up as much as possible. And the way that you can do that, because the carpal tunnel is like an arch, and it can flatten out when the bones in the wrists are out of alignment. And so what we want to do is we want to help create that arch. So we want to get both sides of the carpal tunnel to close in. So as I put on this next piece of tape, I'm going to push my pinky and my thumb together. Again, it's narrowing the edges, bringing the edges closer together, creating more of that arch. So we're going to use this next piece of tape as a supporting strip. I'm just going to attach it on one side up here. You want it to be up a little bit higher on the wrist so that it supports those carpals. Bring my pinky and thumb together. I'm going to wrap it around my wrist and attach it on that other side. And activate the adhesive. So now I've got the yellow tape that's keeping my wrist held back, and I've got the black tape. As you can see, this is my hand in neutral. It's closed up this area a little bit, so that's going to help decrease the pain. The other thing the rock tape has is something called rock sauce, and it is a pain relieving, it's a mentholatum based product, but you can also use that over top of the tape, and you can rub it in. It's not going to affect the adhesiveness, and it's going to hold the pain relieving cream on there even longer, so you get a maximized result out of both of your tape and of the cream you're using. Not all creams will work well with the tape, I could also put it along this strip if I wanted pain relieving, and then just reapply it as needed. Now this tape will stay on for about 5 to 7 days, or up to 5 to 7 days, even with swimming, showers, as long as you're not catching the ends on things. And if the ends start to pull away and fray, just take some scissors and just trim them up. But I still have full range of motion with my wrist. It feels a little bit more supported, but my body now knows to pay attention to this area and to decrease the inflammation in that area. So that's how you can help take care of yourself with your carpal tunnel in between times where you're getting it adjusted by the chiropractor, again, to make sure that those carpal bones are in the proper place and the elbows in the proper place. So again, this is Dr. Brad Shaw with Shaw Chiropractic, Spinal Health and Wellness, and I hope you have a healthy and wonderful day.